Good morning. We know we have a lot to be proud of in the state of Washington in our fight against the COVID pandemic. We know we have saved tens of thousands of lives, but we know today the state of Washington is at risk because of the rising cases of COVID and the Delta variant that is so dangerous. We know that progress has been slowed because of that Delta variant, and we know we have to remain vigilant, in part and primarily because not enough people have been vaccinated with this life-saving drug that is now available to us. So we know we need to take action. We know we have saved 10,000s of lives because we have always followed science, and we will do that again today. So today I'm announcing that we will continue our safe practices of masking for our students and our young people, and we will ask people to consider masking in other conditions consistent with the CDC recommendations. I want to show you what I mean by this. The cases going up, you'll see the epi curve that has shown the previous 4 waves. We now are in another wave. You might call it the 5th wave, but whatever you call it, these numbers are going up dramatically. And that is most concerning, because while our hospitals today can handle the disease load, that curve is very steep, essentially as steep as it has been in most of the previous waves, and unfortunately is consistent with many of the, if not all of the places across the United States that are similarly experiencing the attack of this Delta variant. We know the dominant variant today is the Delta variant. It is twice as infectious. It is more likely to cause serious illness, and it is easily the most dangerous mutation to date of this virus. And we know that this curve is trending upward. You might think of this as a new virus in some sense, given how different it is from the previous virus mutations. We would have liked to have thought that when we have reached this level of vaccination that we would have blunted this virus. But it turns out the science shows us that the mutations that have occurred in this virus are significantly more infectious. That makes it very clear to us that there is one way out of this pandemic, and that is more vaccinations. But until we get more people vaccinated, we've got to be cautious, and that's what we are being today. So it is unfortunate that we are in this position because we have the tools to beat this. We have the tools to break the back of this COVID pandemic, but there are too many people who, although they have access to a free life-saving vaccine, have not availed themselves of that. It is an effective, safe tool. We know it works, but we have challenges getting enough people actually taking the vaccine. I want to show you our vaccination rates on, I don't know if this is daily or weekly, but you'll see that in April and May we were hitting numbers in the 60,000 a day number, and that has declined dramatically, where we're down in the single digits, mostly on per day numbers. Those numbers need to improve dramatically if we are going to get to a level to break the back of this pandemic. Unfortunately, it is also very disparate in our vaccination rates from county to county. I'll show you our county numbers to show the difference. You'll see that it is a high of San Juan County for those over the age of 12 that are eligible for the vaccine of 81.4%. That goes down to Garfield County to 31.7%. That disparity is dangerous, and most dangerous in these communities that have these low vaccination rates, because we have seen across the country similarities between low vaccination rates and high infection rates. We want to save every life in the state of Washington, east and west, urban and rural, and so we have some more work to do. So I think the challenge is we have to realize there's not just one virus in our state, there's two. One is the COVID virus, but the second is just as deadly, and that's misinformation. Unfortunately, too many of our citizens have been attacked by misinformation, much of it on the social media, which has caused them to ask questions about the vaccine and have blunted the ability for people to save their lives by getting this vaccine. Now, we are trying to bust those myths that have been perpetrated on social media, but I do encourage anyone who has a question about the vaccine to talk to your medical provider. Those are the people with the know. And we have started a program called POP, the Power of Providers, where physicians are working with us to be willing to share information with patients. The more people do that, the more people will make a decision that will save their lives and those love them. Now, this is frustrating because we are past the point in this pandemic where the general public should have to deal with more restrictions. Because more than 1 billion people worldwide and hundreds of thousands have had the vaccine safely in our neighborhoods and in our country and in our state to show that this is a safe vaccine. But we remain optimistic because we know people can change their minds. We know people, when they get the right information, make decisions to get the vaccine. And most importantly, we know everyone wants to save lives of the loved ones around them. So this just isn't about your life, it's about people around you. And as we think about this, we are confident going forward. Now, there's one very important unvaccinated group that cannot use this life-saving tool, and that is our children under the age of 12. I know many parents are concerned about their young kids, we all are, and this is one reason why we're going to make some decisions today. So we are today announcing we will continue as we open our schools, and we will open our schools this fall. We will continue our existing policies regarding masking. So all students and employees will be required to wear masks around each other in the building regardless of their vaccination status. This simply maintains our existing requirements for schools. Importantly, this is a legal requirement that all districts will need to follow. We have to prevent the spread of COVID, obviously for the health of our children, but we also want to keep our schools open. We don't want to see waves of this virus going through the schools and force the closure of these schools. Our kids need to be in the classroom this fall. Now, if we can turn these COVID numbers back, we can revisit these obviously in the future weeks and months. But right now we know that this is a significant risk and we have to respond to it. This is consistent with the CDC guidelines they just announced, but it importantly is simply a continuation of what we've previously done with success in the state of Washington. So certainly while this virus is increasing is not the time to decrease the protection of our young children. We will protect our young children. For those who've hoped that we would not have to continue that mask requirement, I certainly understand that frustration. But these trends are getting worse. And let us recognize the reason for the necessity of this. It is because not enough people have been vaccinated. But we ought to be optimistic that that is in our power to change. As people get more information, they can make a decision to get vaccinated for their benefit and their families. We believe that that will happen. We simply need to accelerate the rate of that decision making. So obviously we need to think about masking for everyone in the state of Washington. So we are recommending statewide that people consider wearing a mask regardless of their vaccination status and give thought to the type of conditions when you are indoors about wearing a mask regardless of vaccination status. This is only a recommendation. It is not a legal requirement. I know it's frustrating for people to even have to think about that, but that's the situation we are in, and the more people that get vaccinated, the less we'll have to think about this. Look, this vaccine works. And frankly, it is maddening that we have a life-saving medicine that can save people's lives that's free, that we still have to be in this position. And we can all do something about that, not just getting vaccinated, but to talk to our loved ones about getting vaccinated. And we know that because we know that the CDC has shown there's increasing evidence that even vaccinated people can transmit this disease, and that's the basis of the recommendation. That new evidence makes vaccinations more urgent, both the evidence that this is more transmittable as a variant, but also this new information that CDC has shared with us that even vaccinated people can transmit the disease to other people. Now, that's not to say this isn't a life-saving vaccine. It is incredibly effective, incredibly effective. The vast, vast majority of people who are in hospitals today have one thing in common. They're unvaccinated. 96% of all the people in our hospitals today have one thing in common. They didn't get the vaccine. We want to drive those numbers down. Now, we know this has always come in waves, but this is more like a riptide. We hit some major milestones in the summer, but we can't go backwards. If our hospitals are overrun, it won't be just those who have COVID who are affected. Those who have heart attacks, those who want to go to the ER, those who have traffic accidents, would not have adequate medical care. We simply can't get back into that risk. So we're not done fighting this virus. We're going to keep it up. We should have an attitude of defeating it. We should have an attitude of protecting ourselves while we're doing that. And we should have an attitude of optimism that the more people get the straight scoop, they're going to be more comfortable with this vaccine.